Superior vena cava syndrome due to fibrosis. So superior vena cava syndrome is actually a group of symptoms caused by obstruction of the superior vena cava. The vast majority, up to 90% of the cases, are caused by mediastinal tumor or a thrombus. However, an unusual cause would be vascular fibrosis, which is going to lead to narrowing of the lumen due to the use of chronic central vascular catheters. In our case, going to highlight the challenges in making the diagnosis along with the challenges in the treatment options for those patients. The case talks about a 39-year-old woman with a history of sickle cell anemia that is exchange transfusion dependent for over 20 years. She presented with insidious onset swelling of her face, neck, upper chest over 3 months. She had a right-sided port that was over 5 years old, along with a left-sided port for peripheral access that was also been there for years. On physical examination, she was noted to have this swelling of the face, neck, and chest, but she also was found to have dilated veins in the upper chest. Initially, she was diagnosed with angioedema, or we thought she had angioedema, but she failed to respond to steroids. And then because of the swelling, she was thought to have heart failure, but did not respond to diuretics. So we got a CAT scan of the thorax because SVC was one of the differentials, but was deemed as normal by radiology. However, because we really had a strong suspicion, we reviewed the scan again with the radiology department, and which actually did show narrowing around the meeting point of the ports over here, the red arrow. But the artifact from the ports was obscuring the meeting point, which made the diagnosis very challenging. And so we got a venogram which did demonstrate congestion of the azygous system, kind of supporting the diagnosis of SVC syndrome. Now, after we made the diagnosis, we had a discussion on how to treat this problem, because unlike the SVC that is caused by a thrombus, in which we treat with anticoagulation, the one that is related to tumor, you can give steroids or radiotherapy or chemotherapy depending on the type of tumor that's going to lead to resolution of the symptoms. Here, the treatment was more challenging. So we opted to do balloon angioplasty. We removed the left port, and that was followed by a complete resolution of the symptoms. So, SVC syndrome, when caused by fibrosis due to the chronic catheters, it does present a diagnostic and therapeutic challenge because of the artifact from the ports that can obscure the narrowing of the SVC. And venogram in this situation can help by showing a congestion of the azygous vein. There is limited data when it comes to treatment and the best treatment modality in this setting. In the literature, the endovascular treatment with is shown to be effective and safe in mediastinal fibrosis. Stenting does carry a risk of thrombosis, but our case demonstrates that balloon angioplasty is possible a treatment for patients with fibrosis that can be safe and effective. Thank you so much.